Hi everyone, welcome to another video of NS Pharma. In today's video, we are going to study 20 important multiple choice questions. These questions are very important for the competitive exams like Govt Pharmacist exam, Gpat Niper Drug Inspector and PROMETRIC exams of different countries. I also included some previous year exam questions in this. So try to do all the 20 questions and comment your score. Before going into the video, if you didn't subscribe until now my channel, please subscribe the channel and also press the bell button so that you will get the notification whenever I upload new videos. So let's begin. First question, displacement value is calculated for the preparation of options are option A, suppositories, option B, emulsions, option C, ointments, and the last option, tablet. Okay, so the question is displacement value is calculated for the preparation of. The correct answer for this question is option A, suppositories. Displacement value is calculated for the preparation of suppositories. We know that what is displacement value? Displacement value is the volume of a drug that can displace 1 gram of suppository base. That is called displacement value. Okay, displacement value is the volume of the drug that can displace 1 gram of suppository base. Now we will move to the next question. Question number 2. Question is, Cyanoticone is a component of several antacid formulations. Chemically it is. Chemically, what is Cyanoticone? That is the question. Cyanoticone is a component of several antacid formulation. Chemically it is. Options are wax, option B, fat, option C, aldehyde, and the last option, that is silicone. Okay, chemically Cyanoticone is. The correct answer for this question is option D, silicon. Silicon. Okay, chemically Cyanoticone is a silicon. So one thing you have to note it down that cyanoticone and dimethiacone are not chemically same. They are not same chemically, but they are used as an anti-flatulent. Now we will move to the next question. Question number 3. Creatine clearance is used as measurement for. Creatine clearance is used for as a measurement for. Options are option A, glomerular filtration rate, option B, renal excretion rate, option C, drug metabolism rate, option D, passive renal excretion. Creatinine clearance is used as a measurement for. The correct answer here is option A, glomerular filtration rate. That is the correct answer. Creatinine clearance is used as a measurement for glomerular filtration rate. Okay. Now we will move to the next question. Question number 4. The Central Drug Laboratory is established at. Central Drugs Laboratory is established at. Options are option A, Calcutta, option B, Lucknow, option C, Izzatnagar, option D, Kasauli. Okay, there are 4 options. So the correct answer for this question, that is the Central Drugs Laboratory is located or is established at. Correct answer here is option A, Calcutta. Calcutta is the correct answer here. Central Drugs Laboratory is located at Calcutta. So one more points we have to study in this question, that is government opium factory. This is also an important question you can expect in exams. So government opium factory is situated at Ghazipur, that is in UP, Uttar Pradesh. Okay, that is the oldest government opium factory. Ghazipur is the location where government opium factory is situated. Another opium factory, that is government opium factory, is there in the Madhya Pradesh, that's in Neemuch. Okay, so 2 government opium factories are there. The oldest one is Ghazipur, UP, and the second one Neemuch in MP. Madhya Pradesh. Okay. One more thing, that is here in this option C, Izzatnagar. That is Indian Veterinary Research Institute is located at Izzatnagar, Bareilly, UP. Okay. In Izzatnagar, what is the Indian Veterinary Research Institute, or in short IVRI, is located at Izzatnagar. Okay. Now we will move to the question number 5. Question number 5 is Madrel's salt is. What is Madrel's salt? Options are sodium metaphosphate, option B sodium thiosulfate, option C sodium metasulfate, and last option sodium chloride. Options are sodium metaphosphate, sodium thiosulfate, sodium metasulfate, and the last option is sodium chloride. Question is Madrel's salt. The correct answer is option A, sodium metaphosphate. That is called Madrel's salt. Madrel's salt is used for the dental health as an abrasive agent, polishing agent, and also in dentifrices. So we will move to the next question. Question number 6. The question is Digitalis is cultivated in. Digitalis cultivated in. Options are Andhra Pradesh, option B Bihar, option C Kashmir, and the last option Kerala. Digitalis is cultivated in. The correct answer here is option C Kashmir. Digitalis is cultivated in Kashmir. Okay. Now we will move to the question number 7. Pyrethrum is used as. Pyrethrum is used as. Options are bactericide, option B pesticide, option C fungicide, and the last option is insecticide. So question is pyrethrum is used as. The correct answer here is pyrethrum is used as insecticide. Okay, it is used as insecticide. Pyrethrum synonym is insect flower. It is also called insect flower. So the use is insecticide. This pyrethrum, so many people apply this pyrethrum directly to the skin as an insecticide, particularly for the mites and lice. Okay, this pyrethrum is directly they are using on the skin for removing the lice and mites. Okay, so this biological source, when we are talking about the pharmacogenesis of pyrethrum, the biological source of pyrethrum is it's the dried flower heads of Chrysanthemum cinerifolium. Chrysanthemum cinerifolium belonging to the family Compositae. Okay, the family is Compositae. Okay, now we will move to the next question. So I am just giving some important points related to the questions. If you don't know these points, you can write it on in your notebook so that you will get some extra points other than these questions. Now we will move to the next question. Question number 8. The family of Arjuna Bark is. The family of Arjuna Bark is. Options are Solanaceae, option B Rutaceae, option C Combretaceae, and the last option Neetaceae. Solanaceae, Rutaceae, Combretaceae, Neetaceae, the family of Arjuna Bark. The correct answer here is option C Combretaceae. Option C Combretaceae is the correct answer. So what is the biological source of this Arjuna Bark? Arjuna Bark is the dried barks of Terminalia Arjuna, belongs to the family Combretaceae. Here the question was family. So dried barks of Terminalia Arjuna, that is the Arjuna Bark biological source. One another thing is the drugs that is also related to this Combretaceae family. It's the synonym, the biological source is Terminalia tubula. Terminalia tubula. The drug name is myrobalan. Okay, myrobalan is Terminalia tubula. The family is Combretaceae, but Arjuna Bark biological source is terminalia Arjuna and belongs to the family Combretaceae. Now we will move to the question number 9. Oxygen enters a cell via options are filtration, option B osmosis, option C diffusion, and option D active transport. So oxygen enters a cell via simple diffusion is the correct answer. Here the option is C, diffusion is the correct answer. So because simple diffusion, in the simple diffusion there is no need of any energy. They are working on the principle of concentration gradient. The oxygen will move from higher concentration to the lower concentration. That is called diffusion or simple diffusion. So this oxygen enters a cell via simple diffusion. Now we will move to the next question. Question number 10. The percentage of sucrose in simple syrup. The percentage of sucrose in simple syrup. Options are option A 50% weight per weight, option B 33% weight per weight, option C 66.7% weight per weight, and the last option 100% weight per weight. The percentage of sucrose in simple syrup. The correct answer is option C 66.7% weight per weight. That is the correct answer. So what is simple syrup? In simple syrup there is sucrose and water. That's all. Only sucrose and water, nothing other than this. This is called simple syrup. Okay. Now we will move to the next question. Question number 11. That is Antisebos means. Antisebos. That's Latin term Antisebos. Options are 2 times a day, option B before meals, option C at bedtime, option D after meals. Antisebos. Sebos means meals. Anti means before. The correct answer here is option B before meals. Okay. Now we will see each option. That is first option 2 times per day. 2 times a day. That is BID. Bisindi. That is called 2 times a day. Next one before meals. That is Antisebos. The third option at bedtime. That is HS. Okay. HS is at bedtime. Homnisorum. That is called homnisorum. That is HS. Next one after meals. After meals sebos. After post sebos is the after meals. Okay. The Latin term for after meal is post sebos. Now we will move to the next question. Question number 12. Type of emulsion produced with beeswax. Type of emulsion produced with beeswax is options are oil in water, option B water in oil, option C both type, option D none of the above. So the question is type of emulsion produced with beeswax is option A oil in water, then option B water in oil, option C both type, and option D none of the above. So the correct answer for here, the type of emulsion produced with the beeswax is water in oil emulsion. That is option B is the correct answer. Other emulsifying agents which also promotes water in oil emulsion formation are, one is lanolin, another one is wool fat. Lanolin and wool fat also will promote water in oil emulsion formation like beeswax. Okay. The other one, that is what oil in water emulsion. For the formation of oil in water emulsion, the promoter, that is the emulsifying agent, is lecithin. Lecithin will promote oil in water emulsion formation. Okay. Now I will say one more time because this is a little bit confusing. Beeswax, lanolin and wool fat all will promote water in oil emulsion formation. Okay, water in oil emulsion formation. But lecithin will promote the formation of oil in water emulsion. Hope you got it, this one. Now we will move to the next question. Question number 13. Phenol in bracket commercial is a commercial phenol is a, options are solid, option B liquid, option C gas, and the last option none of this. Anyway, there is no chance for none of this. So phenol, commercial phenol is, the correct answer is option B, liquid. Liquid is, phenol is a liquid. Question number 14, acetozolamide. Acetozolamide is, it's a pharmacology question. Option A, diuretic. Option B, carbonic anhydrase inhibitor. Option C, used in glaucoma. And the last option, all of the above. So what is true about acetozolamide? Acetozolamide is a diuretic. Acetozolamide is a carbonic anhydrase inhibitor. Acetozolamide is used in the glaucoma, or option D, all of the above. The correct answer is here, option D, all of the above. Because acetozolamide is a weak diuretic. It's a weak diuretic. It's coming under the class of carbonic anhydrase inhibitor. The other weak diuretics are osmotic diuretics. Then other one is potassium sparing diuretic. Potassium sparing diuretics examples are spironolactone, then amiloride, then triamterene, then eplerenone. These are the different drugs which is coming under potassium sparing diuretic. I forgot to tell the osmotic diuretic example is mannitol. Mannitol is the example for osmotic diuretic. So osmotic diuretic, potassium sparing diuretics, and carbonic anhydrase inhibitor, that is acetozolamide, is all coming under weak or adjunctive diuretic. Weak or adjunctive diuretic. It's coming under weak diuretic or adjunctive diuretic. Now we will move to the next question, question number 15. In angina, nitroglycerin is given. In angina, nitroglycerin is given. Options are orally, option B, subcutaneous, option C, sublingual, and the last option is IV. In angina, nitroglycerin is given. Option A, orally, option B, subcutaneous, option C, sublingual, and the last option, IV. The correct answer here is sublingual. Option C, sublingual, is the correct answer for this question. In angina, nitroglycerin is given as sublingual. Okay, sublingual dosage is preferred during angina. Okay, so it will bypass first pass metabolism, so it will get rapid action. Now we will move to the next question, question number 16. Oral anticoagulant. Oral anticoagulant. Options are heparin, option B, warfarin, option C, protamine, option D, all of the above. Oral anticoagulant. The correct answer here is option B, warfarin. Warfarin is the oral anticoagulant, because warfarin is only anticoagulant. That means in this option, warfarin is the only anticoagulant which is active orally. Okay, so heparin is a parenteral anticoagulant. What about protamine? Protamine is not an anticoagulant, it is the antidote of heparin. Protamine sulfate is the antidote of heparin. Okay, now we will move to the next question, question number 17. Government opium factory is at, this one we already discussed it in the question number 4. Government opium factory is at, options are Ghazipur, option B, Izzatnagar, option C, Lucknow, option D, Calcutta. These are the options. So we know that the correct answer is Ghazipur. Ghazipur is the correct answer here. Government opium factory is located at Ghazipur and Neemuch. Out of that, here only Ghazipur is there, so we will select Ghazipur. Okay, now next question, question number 18. The first edition of Indian Pharmacopoeia. The first edition of Indian Pharmacopoeia was published in the year. This is an important question. So many competitive exams already asked this question, or they are asking based on the year of different editions of Indian Pharmacopoeia. So you have to study this very well. Anyway, all the questions are important. In the introduction itself, I told you all the questions are very important as per the competitive exams. So anyway, this is some more important. So the first edition of Indian Pharmacopoeia was published in the year Options are option A 1940, option B 1985, option C 1955, option D 1966. So the correct answer, the first edition of Pharmacopoeia was published in the year option C 1955. The first edition was in 1955. We are talking about Indian Pharmacopoeia. So about the second edition. Second edition was on 1966 and third edition 1985. Okay, 1955, 1966, 1985. That is the third edition. Then 1996. That is the fourth edition. Then fifth 2007. Okay, from 1996, the fifth edition came in 2007. Then 2010. Then 2014, and the last one, that is 8th edition, and the latest edition is 2018. IP 2018 is the latest edition of Indian Pharmacopoeia. Okay, that is the 8th edition and the latest edition, that is on 2018. Okay, now we will move to the next question. Question number 19. Ranitidine is used primarily to treat. Ranitidine is used primarily to treat. Options are diarrhea, option B ulcers, option C infant colic, option D trigeminal neuralgia. So what is the use of ranitidine? We got the 4 options. The correct answer here is option B ulcers. Ranitidine is useful for the treatment of ulcers. We studied drugs which is used for the gastric peptic ulcer. What are the drugs? Do you remember? Okay. Now we will study drugs which is used for the peptic ulcer, used for the treatment of peptic ulcer. First category is gastric acid secretion inhibitors. Okay, gastric acid secretion inhibitors. That is the first class. Then second class is antacid. Third class is protectives or ulcer protectives, and the last class, that is H. pylori drugs, anti-H. pylori drugs which is acting on H. pylori. These are the 4 different class of drugs that is acting on, that is used for the treatment of peptic ulcer. So first one, gastric acid secretion inhibitors. This ranitidine, cimetidine, famotidine, roxatidine, all are coming under one group inside this one, that is H2 antihistamine. H2 antihistamines, that is one class. This H2 antihistamines is working on the principle of gastric acid secretion inhibitors, and another type inside gastric acid secretion inhibitors is PPI, that is proton pump inhibitors. Proton pump inhibitors. Examples are lansoprazole, pantoprazole, then omeprazole, esomeprazole, all are coming under, even rabiprazole, all prazoles are coming under this proton pump inhibitors. This is also a gastric secretion inhibitor, gastric acid secretion inhibitor. Next one, that is antacid. Antacid, the drugs coming under antacids are sodium bicarbonate, magnesium hydroxide, aluminum hydroxide, etc. Then ulcer protective, example is sucralfate. And the last class is anti-H. pylori drug. Anti-H. pylori drugs, they are antibiotics like amoxicillin, clarithromycin, metronidazole, tinidazole, etc. So these are coming under drugs acting against the peptic ulcer or used for the treatment of peptic ulcer. So we were discussing question number 19. Now we will move to the last question of this video, that is 20th question. Diony is a brand name of some medicine. What is the name of the medicine inside the diony? Option A, CNS depressant. It is not asked for the medicine name, it is asked for the class. So option A, CNS depressant. Option B, male sex hormone. Option C, oral anti-diabetic. Option D, female sex hormone. So diony is a CNS depressant, male sex hormone, oral anti-diabetic, or female sex hormones. Diony, we know that diony is oral anti-diabetic. So correct answer is option C. So what is diony? Diony is glibanglamide. Okay, glibanglamide. It is chemically glibanglamide. Okay, hope you understood these 20 questions. Thank you very much for watching this video. Hopefully we will come with the next part soon. Before leaving, subscribe the channel and also press the bell button so that you will get the notification. One more thing, don't forget to share the link with your pharma friends. Thank you.